The discipline of health promotion and education, also called wellness studies, aspires to educate communities in the skills needed to maintain personal health. As medical costs skyrocket, it has become clear that the health of individual Americans has an effect on society as a whole. The cost of treating preventable conditions is passed on to everyone via increased taxes and health insurance premiums. Health promotion and education professionals emphasize improvements in diet, exercise, behavior and even attitudes. This process may seem simplistic, but students who take on health education as a career become familiar with the intricacies of physical health and the challenges of motivating a community or society toward awareness of health issues. What does a health promoter and educator do? Health educators promote awareness of health issues as diverse as obstetrics, tobacco prevention, HIV/AIDS awareness and prevention, dental disease prevention, bone disease prevention, heart disease prevention, teenage pregnancy prevention, maternal and child health, emergency medical practice, immunizations. Health promoters and educators often work with the community. Health education and promotion programs generally focus on the health and well-being of individuals, instead of addressing theory or policy. The fields of study that serve as the foundation for health promotion and education include biology, health communication, human development, public health, health services, health psychology. Inspiring healthy decisions. Motivating a society to actively encourage good health is no small task. Americans in particular are fond of junk food, sedentary jobs and low-key leisure activities. Improving public health takes legions of professional health educators working in every possible venue from schools to mass media. This career path includes such responsibilities as organizing and motivating the community to work toward the common goal of overcoming health issues, utilizing modern technology and up-to-date information to help entire communities promote the health of each individual, organizing and implementing programs that promote healthy living, studying, maintaining and evaluating public programs that promote healthy living, organizing groups and coalitions that advocate health awareness in government and enact or change policies to this end. Do you have what it takes to be a health promoter? Health education is a rigorous profession. Before embarking upon any course of study, make sure that this field is right for you. This field requires intensive study. It is a combination of science and social work. You will facilitate and organize groups of people to achieve a common goal. You will work with issues of biological, psychological, social, physical, and medical natures. As a health promoter and educator, you will develop and implement strategies for improving our collective habits, attitudes, and behaviors. Such strategies demand a detailed understanding of a society's approach to diet, exercise, and other habits. Personal qualities of successful health education and promotion professionals. When you embark upon a degree path as specialized as health promotion and education, you should consider whether your personal qualities are suited for this work. Some important questions to ask yourself are: do I like working with people? Do I work well with others in a collaborative manner for a single purpose? Am I interested in how we use and care for our bodies? Am I interested in working as an educator? Am I willing and able to embark on a specialized field of study? Would I consider myself a people person? Do I care if people are healthy? Am I concerned about the eating habits in my society? Am I aware of my own diet and exercise habits? If you answered yes to the above questions, you should be a good fit for this challenging, rewarding career. Key skills of certified health education specialists. Successful health promoters and educators possess great leadership abilities. These qualities emerge during a student's education, especially when they volunteer to be class leaders, peer tutors, or assistants to instructors. Students with innate leadership abilities will be naturally professional, caring, and capable of solving problems. Professional health educators develop many of the following skills during their degree programs. Assess individual and community needs. Health educators must be careful not to impose their own agenda on a community without first understanding the real wishes of its residents. Otherwise, their initiatives will meet with significant resistance. Skilled educators can integrate surveys and polls into the first phase of a long-term program to test the waters for future outreach. Plan and develop health education programs. Based on professional assessments, health educators work in teams to strategize long-term rollouts of their programs. By prioritizing program elements based on budgets and public demand, effective educators build awareness of their program long before providing key services in target areas. Implement health education programs. After developing core strategies and building public demand, health educators must hit the streets to deliver their messages. Depending on the kind of program, educators may use a variety of mass media and direct client contact to execute their plans. Manage programs and personnel. Skilled health education professionals oversee teams of specialists that work together to deliver program services directly to target communities. Team leaders often recruit publicists, community organizers, social workers, teachers, clergy, and other key people to execute successful programs. Juggling the schedules of these team members and providing them with resources becomes the central focus of the project manager. Evaluate health education programs. To justify continued funding and to gauge the effectiveness of programs, health educators develop a set of metrics they can use to quantify program results. Much like the process of evaluating customer service in a private business, program leaders must act quickly if programs fail to meet the objectives of the original plan. Act to change government policy. Health education and promotion does not just take place in